Former President George H.W. Bush is still in a Houston hospital tonight as doctors treat him for a blood infection. A family spokesperson says the 93-year-old is responding and recovering and eager to get well so he can get to his summer home in Kennebunkport, Maine. Mr. Bush was hospitalized Sunday, a day after burying his wife, former First Lady Barbara Bush. So what exactly is the blood infection the former president has, and how serious is it?
We asked medical reporter Meg Ferris to find out what about this is going on and why this may have happened the day after his wife's funeral.
Former President George H.W. Bush has what is called sepsis, which can cause vital organs to not work or even fail. When your immune system begins fighting that infection, it also causes friendly fire, so to speak. So it's not regulating itself, so your body gets hurt as well.
It's always a concern. Patients die from sepsis, 30 to 30% mortality rates in general. But the more severe the sepsis, so severe sepsis, septic shock, you're talking about mortality rates that begin at 40 to 60% or more. And in the elderly, those rates are even higher.
Dr. Fred Lopez is an infectious disease expert at LSU Health. He's not treated the former president. But we also asked him about something called the widowhood effect. Studies show why spouses may die within a short time frame of one another.
It is quite clear that the all-cause mortality rate is increased, particularly shortly after the death of a loved one.
By many accounts from family and friends, the Bushes had a very close bond in their 73-year marriage. Strong social bonds help people live longer, but stress and depression from loss can affect physical health and the effectiveness of the immune system. But for now, while President Bush is in ICU, a family spokesman says that he is responding to treatments and appears to be recovering. Meg Ferris, Eyewitness News, Medical Watch.
Sepsis is treated with antibiotics and by giving fluids to maintain blood pressure.